Hi, everyone. Thanks for joining us. I'm not sure if we're waiting for more people to join from the waiting room, but we will start. This is the first in our series of talks on brain health perspectives. And I really am honored to be having the panelists that we have on our panel today, and to all of you for joining us, actually. I really do want this to be a very interactive discussion. We will start with a welcome from Professor Andre Mochan, who is the head of neurology here at Wits University in Johannesburg. I will then do a short introduction to the panelists. The panelists will then present, and we will then have our interactive discussion. I'll hand it over to you, Andre.
Hi there, and thanks, Kirti. Greetings to everyone on the call now. I'm sure there will be more joining, but it's really great to have you here and to start this series now with this inaugural session. So, Kirti, thanks for doing this, really, from the bottom of my heart. It's something that is a bit outside my clinician looking after sick brains thinking box. So it's a wonderful addition, really, to our spectrum of what we do. So on brain health, really, brain health includes health promotion and strategies to reduce the risk of illness and improve management, the development of brain skills and brain capital. So it's an exciting field with the potential to help really many people, and that is really the reach that we hope, or the profile that we really hope to build. So Kirti, Dr. Ranchod, we know each other long, so that's why forgive me the Kirti. She is a Global Atlantic Fellow for Equity in Brain Health, and she has started and embarked on that path really many years ago. So she's a senior Global Atlantic Fellow, I would like to call her. And she's a co-founder and chair of the Africa Brain Health Network. So she's a neurologist from South Africa, bred and trained in Johannesburg at Wits, basically. She's currently also associated with us as an honorary lecturer in the Department of Medicine. And she's a co-founder and chair of the African Brain Health Network, as I've mentioned. She's also served on the board of Alzheimer's South Africa and has extensive clinical experience in both medicine and neurology. She founded Memorability to make brain health tools accessible and practical and effective. She runs a series of talks on investing in our cultural capital for better brain health at the Origins Center at the University of Witwatersrand. And with the Africa Brain Health Network, Wits Neurology has initiated now this series of discussions on brain health perspectives to increase awareness and understand priorities and sustain a community that systematically and strategically builds a roadmap to support better brain health relevant to local context. She also, her interests really also include the role of traditional practices in promoting health and brain health, the neuroscience of art, and understanding the different perceptions of memory. So she's really the person driving this. She's done this really all out of her own initiative, drive, and pocket, to say the truth. So, Kirti, with that in mind, I really thank you for pulling this off, and I'm looking forward to a really productive engagement. And for myself, as I said, it's a new territory, and I'm really curious to hear and participate and learn, and wish this to be a really mutually productive engagement. So really thanks for doing that, and grateful that you have put Wits there, and I'm just now being quiet, have talked enough already, and hand over to you as a chair, and wish this to be a great meeting. Thanks.
Thank you, Andre. And I think first, just to acknowledge Andre, Professor Mochan, like Andre says, we know each other for now 30 years, basically. No, 25. So thank you, Andre, for your confidence, and for the confidence, and for understanding how important this is to actually do. I think in neurology, maybe I'll just give some background as to why I'm doing this. There were several reasons in terms of doing this, and one of them was a personal reason. My grandmother had Alzheimer's disease, and just that understanding of initially how little I assumed we could do, but then how much was actually possible, transformed the way I started looking at not just my grandmother, but people in my care as a neurologist. And just to acknowledge Andre as well, most of my training was done with Andre as my consultant. So good or bad, the neurologist I am is in a large part due to Andre and lots of other mentors and teachers along the way. But yeah, I was seeing a lot of people in my clinical practice where actually these illnesses could have been prevented, or the severity could be less. We weren't doing enough. And I think particularly in neurology, you become aware of this. Like there's a lot more that you want to do. And when you start looking at the research, you realize there's a lot more that can be done to prevent and also to promote health, even in people who do have specific illnesses. The third level that motivates this work, and I'm quite passionate about it, was actually that on a societal level as well, we're seeing these huge socioeconomic problems in South Africa, political problems. It's not unique to South Africa. I think all of us can relate to this on a certain level. And this is where I think brain health offers this potential to actually change what we are seeing. And so my actual approach looks at brain skills and what we can actually do to develop this, because I think, like I say, the potential to actually transform the societies we live in, focusing on individuals within that society, is actually quite huge. And this series of talks is really to center these different perspectives and how we approach brain health and what we need to do as a collective community to strategize, to prioritize, to start. So I am very thankful to the panelists who are on our first panel. We're going to have 3 panel discussions, and this will then be followed by an interactive discussion where I really would invite all of you to contribute questions, comments, your thoughts on what our priorities and strategies should be going forward. First, we have Professor Alfred Njamnshi, who is from Cameroon. He is a Swiss board certified neurologist and a neurophysiologist, the professor of neurology at the neurology department in Cameroon at the Central Hospital, Yaoundé. He is the founder and executive director of the Brain Research Africa Initiative, which is the development partner of the African Union Commission and a member organization of the International Brain Initiative. So really quite important work, and we really look forward to your insights. We'll start with you, Alfred, and then I will introduce each panelist as we go on.
Thank you very much, Kirti, and thanks to Andre for introducing us to this. I'm really very grateful and happy to see that you already set this ball, and with Andre's help, you have all that rich experience. I just met you a few days ago in the SONA meeting in South Africa. That's where we got our connection, and I saw immediately that we have a lot in common, and I really appreciated that. So I gladly accepted when you asked me to be on this panel. Brain health, I approach brain health from the historical aspects. I know that WHO has done a lot of work for the past 20 years on mental health. And one of my critics of that approach is that a lot of money has been injected into the mental health program. A lot of resources have been put into that, a lot of training, and a lot of mobilization and sensitization has been done. But recently, when I was reading the 2022 mental health report, one of the statements that runs through the report is that if they were to evaluate what they have achieved, is like the original goals still are sitting there yet to be met. And my approach was that maybe mental health approach as the WHO has done it had some limitations in terms of scope, maybe stigmatized because of what many people misunderstand psychiatric disease to be mental health and all of that. So we have this great opportunity of brain health, which I think personally, the concept is less stigmatizing, more globalized, and I feel that mental health is a subset of brain health. After all, mental health processes, cognitive processes are just part of brain or central nervous system processes. So I'm really glad and excited to be part of this. Another historical background that I have is that I have worked very closely with the World Federation of Neurology under the leadership of Professor Johan Artley, who just passed on a few months ago, and Professor Hachinsky, Vladimir Hachinsky, past president, both past presidents of the World Federation of Neurology, who has worked very, very hard with the WHO to get the IGAP, and then that is the Intersectoral Global Action Plan on Epilepsy and Other Neurological Diseases. And this concept of brain health has been promoted by the World Federation of Neurology, and I was part of that. So I'm really glad that this is taking shape. And to be part of the network that you have put together, Kirti, on brain health and getting to know about the Global Brain Health Institute and talking to some of the leadership there and some of the Atlantic fellows like you that are active, it gives me a lot of hope, and especially for our continent, Africa. So I'm going to just share some ideas, nothing new, but just to sensitize ourselves and our colleagues, and especially the younger generation, that when we want to implement I know that the WHO has already come up last year with guidelines on how countries can work on, develop strategies for promoting brain health in countries, working with the different ministries of health and the other stakeholders. My approach would be that the key element that would trigger is research. When we look at brain health, whether it's normal brain function or brain function in disease and rehabilitation and recovery and all of that, we usually in the African continent lack data in many aspects. If we take stroke, we take dementia, we take epilepsy, headaches, we have very little data. And when we look at the production of neuroscience data on all aspects, whether it's basic neuroscience, clinical neuroscience for brain health, or translational neuroscience, Africa is not the biggest producer of science, of evidence. So we have a lot. We have a gap there that we need to fill in Africa to produce science. Mainly, we have South Africa, we have Nigeria, and then Egypt and a few other countries. Cameroon features in the middle somewhere. So the rest of the African countries, there are places where we don't even have a neurologist. There are countries in Africa with 0 neurologists, no neurosurgeon, no psychiatrist. So the situation in Africa is really very serious. And I think that if we put more effort in producing research from Africa on brain health, that will be the starting point. Research evidence will certainly contribute to practice. We have evidence about some specifics of some manifestations of neurological disease in Africa, or we can look at evidence from genetics, even in therapeutics, some of the drugs that are available out there for neurological disease. Our African populations might not respond as other populations around the world. We lack data in all of these things. So my key contribution to this panel is that one of the starting points is that Africa needs to start producing more of its own neuroscience evidence, evidence that will inform policy, evidence that will inform practice, and then we can move on from there. Another specific gap is that when we look at Africa in general, we see that the English-speaking countries are more advanced in having brain health specialists or brain health actors or brain health care providers than the French-speaking countries. And then in terms of production of neuroscience data, the French-speaking African countries tend to lag behind. And that is an area that we need to improve on. Our organization, BRAIN, has taken upon itself, has given itself the responsibility of trying to encourage and trying to promote this kind of research program, training programs, especially in French-speaking African countries. Right now, as we speak, BRAIN has contacts or affiliations with at least 14 out of the 21 French-speaking African countries in the sub-Saharan African region. And the idea being for us to create more networks, work together, produce data together, use the same methodology or similar methodologies to do similar types of research work so that we can be able to compare results across countries and also compare results from our continent with other continents. And if we cannot produce data ourselves, because sometimes it is difficult, then we use data that has been produced in other continents and adapt them to our own needs. So my suggestion, what I submit to this panel is that research is key. We cannot make progress in brain health without research. Producing our own data and adapting data from other places as appropriate to our conditions, and then using that data to inform policy, using that data to inform practice is what I submit. I would like to end there for now, and maybe if there are some specific questions or areas of discussions, we can still come back on that. So let me hand back the microphone to you. And thanks again.
Thanks, thanks, Alfred, for your insights. I really am looking forward to the questions. We will have the questions at the end of all the panelists' discussions. So we're going to go straight into Funmi's presentation. So Funmi Akindejoye is a Global Atlantic Fellow for Equity in Brain Health. She's also an environmental public health researcher, and her work focuses on environmental risk factors for brain health and how to use nature and art to improve psychological outcomes. She was nominated for the Global Metro Dora Awards as the Female Mental Health Leader in Medicine and Science. And her recent work focuses on case studies on the influence of urban design on mental health. She has conducted case studies in Lagos, Nigeria, Lapua, Finland, and Monrovia, Liberia. So really excited to be hearing from you, Funmi.
Thank you, Kirti. Thank you for the introduction. Thank you, Professor Alfred, for your talk. I really enjoyed it, and research is very important. If you permit me, I'd love to share my slides. I have a few slides.
You can share your slides.
You can see it. Can you see my slide, please?
Yes.
Okay, thank you. So as Kirti rightly mentioned, I will be talking about urban design and mental health. Basically, I want to do like a comparative review on two studies that I carried out in low income country, Nigeria, and also in a high income country, Finland. As an environmentalist, I'll be looking at how the city affects our mental health and how mental health affects the city. This content will guide my presentation. So for introductions, we all know what mental health is, and you agree with me that there is no health without mental health. And it's been researched that 1 in 4 persons will experience a mental health condition globally. So mental health is very important, and especially in cities, persons in cities are at high risks of depression and anxiety compared to persons in rural communities. I want to introduce the Mind the Gaps framework. The Mind the Gaps framework was designed by the Urban Design and Mental Health Center. It showcases and presents key ways in which urban design can improve mental health. It has 4 features. So it talks about how professionals, multidisciplinary professionals can adapt this, be you an urban planner or an architect or a public health person or a policymaker, how can we adapt these features or principles into building to support mental health? So we have green places. There is a positive relationship between green places or nature and improvement of brain health, mental health, and cognition. So it's proposed that green places should be included in and buildings. Also active places. This basically would promote exercise, and exercise in itself is an antidepressant, which can also reduce stress and improve our sleep. So including active places, features such as that will support walking and cycling and make it easy to move around the city, features that are being proposed. For prosocial places that would improve one's interaction with others and integration into society is what the prosocial places here talks about. Can mention a few cafes, churches, public libraries, and so on. So for safe places, definitely safety is important for everybody's mental health, and incorporating this in an urban design would have great effect in the way people's mental health are viewed or how they are receptive to places. Besides crime, you also have safety on the road. Traffic safety is important as well. All right, so moving forward, how does the city affect mental health, and how does mental health affect the city? I'll talk about on two key factors here. For how the cities affect mental health, you have the social and the environmental factor. For social factors, persons that have pre-existing risk factors, such as maybe a minority group, they face social segregation all the time in cities, and this can lead to discrimination and hopelessness amongst them. Then for environmental factors, there is the potential of being overloaded with environmental factors like overpopulation, crowding, noise, and air pollution. And you also agree with me that people that live in cities have less access to green spaces compared to people in rural communities. As well, they have less leisure time because it's either they're working, especially persons that work 9 to 5, and commuting around the city also takes time. So they have less leisure time to also socialize. And how does mental health affect cities? I will put this in terms of cost. So you have both direct cost and on the city, on government, and indirect cost. Basically, when people have mental health issues, they have less time to go to work, and that results in loss of productive man hours. And of course, it results in mortality, increased mortality rates in such places. And of course, disability cost is increased. Cost for caring for such persons also increase. So these are just few points on how the interrelationship between mental health and urban design. So as Kirti rightly mentioned earlier, I did 2 separate studies in Nigeria and Finland. So I would love to do a comparison amongst them. This is just a brief methodology of what both studies I used the same methodology for both studies. It was a qualitative research work where we interviewed 10 professionals ranging from architects to public health specialists and psychiatrists, urban designers. And for Lagos, a brief about Lagos. Lagos has a population of over 20 million, and Nigeria is over 200 million. And one thing that is important to point out here is that Lagos, the landmass of Lagos is less than 1% of the total landmass of Nigeria. But it will interest you to know that it occupies 11% of the population of Nigeria. It houses 11% of Nigeria's population. So you can see how burdened Lagos State is. If you look at the map to my right on the screen, you will see the red point where that's where Lagos is, so you can understand. So Lagos has a high levels of stress and exhaustion, mostly due to daily commuting. Before now, I think myself and Ken Wombe and the other panelists were talking about what the traffic situation is in Kenya. I was quiet because it's higher in Lagos. So Lagos, you can, on the average, you spend like 60 minutes in traffic daily. And I recently checked the traffic index. Lagos had the highest in Africa, second to Kenya. So, Lagos, one of the things about Lagos State is that access to mental health services is limited, and also there is lots of misconception. Even visiting such places, there is a lot of cultural misconception. People don't even want to visit there. Moving forward, there are some emerging themes from the study that we did. I'll just go through some of them briefly. You have as I mentioned earlier, reliable public transportation and traffic reduction is one of the most important, because that results in a lot of irritability, anxiety, and aggression amongst Lagosians, because being in traffic for so long can cause that. So on mental health, it's big. And also on housing and affordability of housing is important, because Lagos has one of the highest real estates in Africa. And research, you find out that people can't really afford it. And that leads me to the fear of forceful eviction. In 2017, there was a report that over 30,000 persons were being forcibly evicted by government for illegal settlement. So they were settled in places where they were not supposed to, but this is all due to the high rate of housing in Nigeria. If you look to some of the pictures I have there, this is the Makoko slum. It's the biggest slum in Africa. So these are this is in Lagos, where some of the persons reside. So these all, these are themes that came up when we had the research work, fear of forceful eviction. And talking about housing still, I'd want to make reference to the high rates of building collapse in Nigeria, or in Lagos specifically. And I think that this is me speculating, but I think it's due to the fact that developers want to build to maximize costs and as well as to increase their profits. So, but this can be tackled with the appropriate agency actually enforcing laws, building laws, and what have you. Availability of and access to green and blue spaces. Lagos has numerous beaches, so we have lots of blue spaces. It's available, but access is a problem because most times they are ticketed, so you have to pay to get in. And yeah, so about green spaces, we have a few green spaces, but due to the fact that Lagos has a small landmass, you can imagine what every space that is available wants to be used up. So this leads me to the wetland protection. There is a lot of wetland encroachment because Lagos is 40% water. So most times people want to encroach into the water bodies to get lands out of it. And so most persons are at the risk of flooding because not the right mitigative measures are not being implemented even after these lands or water bodies are being reclaimed for land use. The non-motorized transportation system in Lagos is poor. So I'll just move on. For the sake of time, just want to touch on some of the suggested opportunities in improving mental health through urban design in Lagos. I have here decentralization. There are 36 states in Nigeria, and Lagos seems to be the commercial capital. If we have such developments in the other 35 states that we have in Lagos, Lagos would reduce in population. So we can explore decentralization as well as the use of waterway transportation. So I'll move quickly to the study in Lapua, Finland. Finland is a sparsely populated population with 5.5 million persons in a landmass of over 300,000 km square. And of course, it's ranked the highest, happiest country in the world for the 6th consecutive time. However, the mental health issues is one of the highest burden of disease in Finland, ironically. 10 to 20% of its population experience depression during their lifetime. So this study was done in Lapua in the northern part of Finland. And these are some of the themes that came out. Of course, for me, it's a learning curve, what we could, as someone from a low and medium income country, what we can bring or how can we learn from this high income country. However, this high income country is not without its challenges as well. So one of such is the availability of green and blue spaces. When the Finns build, they build with lots of large spaces to accommodate green spaces and what have you. So public and commercial spaces, they have lots of that in terms of sports complex, public libraries, and they're all free. So for cultural heritage and identity, this came up as a very important theme because most of the respondents from this study pointed to the, a particular building in that town. It's called I have it here. If you look to the right of my screen, the Vanqua Paku Cultural Center. It used to be a cartridge factory, but it had an explosion in 1976 and 40 workers died. So it was converted to a cultural center. So whenever they talk about it, they talk about it with pride because it kind of, it immortalized the 40 persons that passed. So they see it as, and the building kept, or it preserved those, some of the machineries in the previous cartridge building. So it was not totally put down. So, keeping up.
We'll just have two more minutes just to finish.
Okay, so thank you. So talking about cultural heritage, the point I'm trying to make here is when people share, when there is a shared identity, cultural heritage, it has a way of, initiating feeling of pride, feeling of joy and satisfaction. So the lesson here is preserving our archaeology and our identity, our history. It's very important. So for the sake of time, housing, one of the problems we found in this study from this town is that there is a disparity between age and housing. So we saw the older persons living at another area different from where the younger persons were living. So there was not mixed housing. So that is one of our recommendations. And also the third place concept, maybe I'll talk about that during the question and answer segment. And this is a comparison, I believe I've touched on most of them between both studies. And yeah, this is my conclusion. Thank you very much for listening.
Thank you, Funmi. Really exciting work, actually, and transcending those geographical and discipline boundaries, actually. Must be quite challenging. We're going to have some exciting questions, hopefully. Harris. So Harris is a medical doctor, PhD grad, and he's a brain capital builder who believes that investing in brain capital is fundamental to meeting modern societal challenges and driving innovation. He leads the development of the brain capital field and seeks to place it in the center of economics, policy, finance, and technology. In his career, he has operated as a physician, a scientist, an entrepreneur, author, economic and finance thinker, and a neuroscience diplomat. So quite a wide range. We really are looking forward to hearing from you.
Wonderful. Well, hey, thanks so much, Kirti. Could I get the ability to share my screen, please? But thanks, Kirti, for the opportunity to talk today, and to Andre as well for putting this on, and then to everyone for making the time, including my co-panelists. Okay, I'll just pull up my slides real quick. I'll keep my talk brief. Okay, can you that's coming through? Great. So look, I think that the first two speakers have painted a wonderful picture of being ambitious about brain health because it's so important to society. It's obviously important to Africa. And then also Funmi has outlined how important it is to not just think about brain health in healthcare, but also to think about it outside of healthcare in the built environment. And so what I want to do today is I want to go even more expansive and suggest that brain health is arguably the most critical asset to a country and to a continent. And that's really what I do, is I think about novel projects and novel approaches to building up the value and status of brain health in the eyes of senior politicians and senior business leaders. And I like to think about this concept of brain health policy entrepreneurship. I would want to empower all of you on this call to be brain health policy entrepreneurs. And that means using your creativity, your strategy, your networking, and persuasive arguments like data and such to bring new policies into the open and to promote policy change. So I think that for too long in the clinical realm and in the science realm, we've been a little bit shy about thinking about our role in, frankly, statecraft in changing and modifying countries. So I want to empower all of you to get active and to get engaged in collecting data, in making arguments and persuading and in community building and things like this. So there are obviously massive socioeconomic challenges to do with brain health conditions. That goes without saying. I wanted to point out this is just a tool, the IHME's Brain Health Atlas. The IHME runs the Global Burden of Disease study, and they've just developed the Brain Health Atlas to look specifically at neurological and mental health conditions. So I share this with you as a tool to use it to inform your projects and to influence politicians, business leaders, foundations, and multinational organizations like, African Union and things like that. That's what it is. But of course, bearing in mind that, as Alfred said, there are so many data gaps in Africa that this type of tool may have limitations in your country. But hey, if there's a data gap in your country, in Africa, then use that to convince people to collect that data. So now let's think about some policy change ideas. First of all, it was wonderful that the Financial Times picked up our work a couple of years ago and said that boosting brain health is key to a thriving economy. That if you can boost the nation's mental state, then you can help people in the new economy to have more energy, to have more resilience, more adaptability, and to be more productive. So you can see this is kind of obvious stuff, but it's about how do we link brain health to the vitality of a country's economy? Because if we can do this, we can get the politicians and the senior business leaders to pay us more attention. And so we need to do this with thinking about, economic tools, language, financial tools and language as well. This was a nice overview from a recent paper looking at the benefits of brain health to our economies. So I encourage you to check out this paper and use it. On the left, they show the healthy behaviors for the brain, like being social, managing stress, exercising, all the things we know. And what does that do at a population level on the right? It improves the workforce, it reduces costs, et cetera, et cetera. Again, ways of linking brain health to larger factors. Like Funmi mentioned, the built environment as being important to brain health, which is wonderful. I also just want to share one example of linking brain health and food and nutrition. So we published a paper a couple of months ago through the Baker Institute for Public Policy, where I work, talking about how the industrialized food system is actually undermining brain health. The industrialized food system was important at one stage in making long life food, getting, food that wouldn't perish out to the far reaches of the world. Maybe it still has a role in some contexts, particularly where there's food insecurity. But increasingly industrialized food and the ultra-processed food that develops and the plastic packaging is actually deleterious to our brain health. We know that ultra-processed foods are bad for the microbiome, and they're associated with the onset of depression and anxiety. And we know that nanoplastics in particular, the plastic packaging of food that breaks down, is also corrosive to our brains. And it's, nanoplastic particles that break down from food packaging are on the bottom of the deepest oceans and on the top of Mount Everest and in women's breast milk. So it's a kind of a very concerning area of science. We need to understand what is nanoplastic doing to us. And then the final point is the industrialized food system is responsible for more than 50% of greenhouse gas emissions in the world. So in a sense, taking aim at industrialized food system and trying to think about how to reform it for brain health, I argue is an important vector that we need to think about. And I'd be curious to understand what people think about this in the African context. Do we still need the industrialized food system, to get food to hard to reach places and food insecure places, or do we need reforms? But I'm sure that the reforms of the food system in Africa are different to what needs to be done in California. So I'd love to get people's thoughts on that. And this is a point that I think Funmi kind of stole my thunder to say that there is a lot of work looking at brain healthy workplaces. So just subscale from cities is looking at workplaces. How do we modify workplaces to be better for our productivity and well-being? And we need here areas to focus, areas to explore and ideate, places to socialize, places to rest and reflect. All of that needs to be available in the modern workplace so that people can get what they need out of their day. Sometimes you need deep work, sometimes you need collaboration. And this is essentially a summary of a report from HKS Architects, and it's freely available online. Just Google HKS and brain healthy workplaces. And then final point is brain capital is this construct that we've developed as a way of incorporating brain health and brain skills. And we're suggesting that brain capital needs to be promoted to politicians so that they think about it all the time. Brain capital, we're saying, needs to be thought about alongside how you run your country. So think about brain capital alongside GDP, infrastructure like roads and bridges, forestry, oceans, water, sanitation. Brain capital needs to be in there as well, because for too long, politicians have not thought about the brains and minds of their citizenry. But of course, we know that rates of mental health issues continue to incline, dementia issues are significant, but then also things like air pollution's effects on the brain are important and corrosive to a country. And then fake news or mis and disinformation is another vector that's quite toxic to the brains and minds of a citizenry. So brain capital is our way. It's economic speak. It's meant to speak to economic thinkers and doers. And I try it out and see if it's useful to you. But this is a lot of the work we do and has led to the development of the Brain Capital Alliance to try to articulate and formalize this work and thinking and see how it can be useful to people in Latin America and Asia and Africa and Eastern Europe. So thank you very much. I hope that was interesting, and I look forward to the discussion.
Thank you, Harris. Very, very interesting and really quite broad overview of brain health. And yeah, definitely, I think we need to start looking at food security issues, which are different. Yeah, it would be interesting to see what the audience thinks about that question with regard to food security and over-processed foods. I don't know that we have the same issues, so yeah. So thank you to all the panelists. I think now we're going to have an exciting discussion. The reason I actually invited these three very diverse panelists was really to show how broad brain health is as a field, how we have a global vision, but there has to be local approaches as well. And so how do you actually make all these different approaches work as a strategy? And I think Harris's presentation gave that as an overview as well. But my first question to the panel, and then I'm going to invite questions from the audience. Please either post it in the chat box or just unmute yourself and ask the question. But the first question is, given how broad it is, given, even with regard to research and data collection to improve brain health, there's so much that has to be done, but we need a strategy going forward, right? So how do we start developing the strategy that understands global vision, but has to be appropriate in a local context? Harris, you unmuted, so I'm going to go with you first, and then if anybody else wants to contribute.
Okay, well, look, I think we need top-down and bottom-up approaches. So the bottom-up is we need to rally the community. We need to rally patient groups, clinician groups, etc., to get active on social media. Think about, like, it's a social movement, right? This is a social movement to talk about how the brain health of Africa is its most critical asset. So this kind of bottom-up approach is important. And And in that sense, it's like, what can you do day to day? What can you do to educate patients, to collect some data? But then it gets also to the top-down approach. And so, how do we, I think about what are the institutions in Africa that we can influence? There's, and off the top of my head, it's like African Union, there are infrastructure development banks that exist in Africa that need to invest not just in roads and bridges, but in, infrastructure, human capital, and hard infrastructure for neuroscience and brain health. The UN, of course, and other groups like that. So that's my thinking is but it needs to be coordinated, Kirti, right? So that's where your organization comes in to help coordinate these things so that people aren't higgledy-piggledy and scattershot, but it's an integrated approach to drive change.
Thanks, Harris. Professor Njamnshi?
Yeah, thank you very much. This has been very interesting. I've learned a lot from the other panelists. This is really interesting, and I think, as Harris has mentioned, we need to work together. One of the bottom-up approaches that we've started in Brain Research Africa Initiative is to go to schools, primary schools, secondary schools, and talk to them about the brain, introduce children to brain. We also developed in Brain what we call the Brain Trust Tournament, which is like the brain capital concept you have, which focuses on introducing medical students to neurosciences and helping them to develop careers in neuroscience. We have engaged the administrators, the political people in neurodiplomacy and neuropolitics. So Harris, we have a lot to talk about. We must get together after this. So it's very interesting. And then once we build those bottom-up approaches in the countries, thinking big, but starting small, in a small area where you can manage, and then scaling up. And once you start that in the country, the administration will recognize you and then trust you, and then they can allow you now to help them, because administration is usually very sensitive, very suspicious. So once they trust you, they can allow you to help them develop the top-down strategies, which means brain health action programs that will involve stakeholders and all of that. So I totally agree with Harris that we need both. And the presentation from a colleague from Nigeria, I'm sorry, her name is going off my mind, was interesting because all sectors are involved. The matters of health include all sectors. I usually say, give me any kind of person and I'll try to transform them into a health person, because all sectors affect health, and all sectors, by definition, are health sectors. So it's been very interesting. So I totally agree with Harris.
Thank you. Funmi, do you want to add anything?
Yeah, I think they've said it all, and multidisciplinary collaboration is very, very important. Everybody is involved. I think Harris mentioned nutrition, food. Nutritionists are involved as well. So the job is not just for the neurologist or the psychiatrist. So everyone is involved. And I think that's one, at GBHI, the Global Brain Health Institute, one of the things that we promote is collaboration. It's about multidisciplinary approach to improving brain health. So I think that's that strategy to applies. Thank you.
Thanks, Funmi. I don't see is there any questions. I'm gonna add the provocation then, because I don't see any questions yet in the chat box. Am I right? Remember?
Well, there's one.
Oh,
there's one
question.
question.
Sorry. Yeah, there is. Okay, cool. Please go ahead. I don't know who's first, Wembley.
It's a question from Daniel, who asks, are there specific strategies being considered to address the needs of different age groups? 0 to 5 years, primary school age, secondary school. My top priority will go to the 0 to 5 and primary school age group. So if any of the panelists has a contribution to that question, go ahead.
I should not go first this time. I wait my turn.
I can say something,
yes,
if you
Alfred.
allow.
Yes, please go ahead.
Allow me, like Kirti said, there's so much to do, and you just pick one of the things and start doing it. For that age group, 0 to 5, we have been looking at environmental factors and brain health in Cameroon, and we've been looking at the relationship between onchocerciasis as river blindness and epilepsy and cognition. And we're looking at that across the lifespan. And we've focused on little children. And we actually have an ongoing project that is going to look at pregnant women and monitor them until delivery and follow up the children up to age 2 to see, because we've already demonstrated that exposure to onchocerca affects sleep, gives a higher risk of getting epilepsy, affects cognition. We've published data on that. And we want to see how this happens between conception, delivery, and early childhood. We've barely started, and then maybe in the next 12 months or so to 24 months, we would have data for that. So that's a little example of something that can be done. And lots of people are doing lots of things. One of the things that we will need to coordinate, I know that Harris mentioned coordination, is that lots of people in Africa are doing lots of great things, but we don't know about. So one of our responsibilities is to actively find out who is doing what and what are they getting, so that that information is brought up to the marketplace and that everybody knows, and we can build on that. So lots of things are happening, and I think that this kind of coordination and platforms will help us to know what we're doing, what is left to be done, how we can put the little pieces of the puzzle together.
And I would, the brilliant points, I would just add, there are two kind of public awareness links that I just shared, which are relevant to 0 to 5, and then also from probably 5 to 10. 0 to 5 is, there was the most popular TED talk of last year was from a 6-year-old Australian girl called Molly Wright, talking about the importance of brain development from her perspective. And it was developed by a Australian foundation, the Minderoo Foundation, that specializes in early childhood brain development. And so this thing went viral all around the world. It's very cute because it was a 6-year-old with an Australian accent presenting it. But interestingly, Minderoo operates a lot in Africa. They operate also in Indonesia and Afghanistan. So I would say check out that link, and then Minderoo's Thrive by 5 initiative. But this is more sort of health promotional kind of parental education stuff. And then the second thing was My Brain Robbie, which is for 5 to 10 years. And this is like a cartoon and, cartoon brain that teaches kids about brain healthy activities. So it's another educational instrument that was developed by a GBHI fellow out of Paris. Yeah. So anyway, those are my thoughts.
Perfect. Thank you. We'll go on to the next question, I think, and then is that fine for me? I see Tendai's hand up.
Yes, thank you so much, Kirk. Sorry, my camera is off. Apologies for that. I'm not in a good space to have it on. My question is to Dr. or Professor Njamnshi as well as Harris regarding research. I missed the initial part of the chat, but he mentioned something around research needing to be done in the African context when it comes to brain health. So my question is, there is this example that has been given by Harris on food having a direct impact on brain health. And in the African context, at least as far as I'm aware, the seed is actually privately owned by a handful of people. So for example, Monsanto. So in researching, for example, something like food having an impact on brain health in the context of Africa, who is going to fund, number one, that kind of research? Number two, what are the decolonial and indigenous ways that you may have maybe looked at or have considered regarding brain health and researching that instead of also looking purely from a Western modality or Western point of view? That's my question. And either Dr. or Professor Njamnshi and Harris can answer that whoever can. Thank you.
Alfred, do you want me to go first or you go first?
You go first.
Okay,
You have the floor. Yes, please.
So there is a very interesting Australian First Nations program for brain health empowerment and activities in an Indigenous community in Queensland, Australia. And it's called Gilia Pina. I'll share the link. I'm surprised I can recall it because it's still early for me and my brain is waking up. But that's the best example that I've seen so far of a First Nations cultural approach, which of course is critical. And maybe we need to develop like a framework for supporting communities to develop their own, based on their own cultural context. That could be a meritorious piece of work. That now that's been mentioned, and then on the food side, I think you could try, like, let's try to get these big industrialized food companies to provide funding. They should feel guilty. They should feel guilty. So let's take their guilt and convert it into research money and leverage it to do research, and then ultimately it may come back to be going against them. But I think, companies like Nestle and such, they do fund research. So let's try that. But let's also think about foundations like Gates Foundation and other philanthropies. And there's a question, an open question is which foundations and philanthropies fund this kind of work in Africa? Is it Mr. Dangote in Nigeria? I don't know. He's a very wealthy man, but is there an inventory of these foundations that you can start to go to when you have projects to ask these people for support? Or how do you engage them in this initiative, Kirti, that you're building out? Over to Alfred.
Alfred.
Thank you. I would say we go for the funding where it's readily available. Paris mentioned these big food companies, but they might hesitate knowing that if we are trying to prove that what they're doing is not good, they might not quite fund it because he who pays the piper determines the tune. My point is that if we can work to get African nations realize the importance of research and start to fund research, of course, people like Dangote, people like Dan Polo in Cameroon, the richest francophone in Africa. I mean, we need to, and then you mentioned banks, we need to get to them. And I think working to get banks and other institutions, foundations from Africa to start to pay for research will trigger other people to see that it is useful, and governments may finally understand and then begin to fund research, which they're not doing very much. Somebody has to start somewhere. And I think that this is a good group.
I think I'll just come in here as well, Tendai, because a lot of my work actually focuses on what we have within our traditions, our cultures, our indigenous knowledge systems to actually support better brain health. I don't think we can actually live in the context that we live in and ignore the knowledge systems that we have within our own cultures and the cultures around us, right? And as I started doing this work, when I looked into all the research in terms of what keeps your brain healthy, a lot of it was already embedded in our cultural systems, our ways of living that supported community and connection, our ways of grieving that actually promoted healing, our ways of actually living in terms of, we just wouldn't use the same words in terms of design or mindfulness or healthy eating, but our traditional food was much healthier. Our traditional food was much more accessible. Our traditional food is much more affordable, right? So there's a lot that we have within our traditions and our cultures and within systems. I think that the health system needs to be configured differently to include, as you're saying, right? Health actually is broader than the health system as we think. It includes design, it includes art, it includes food. But once you start doing that, then the health system also has to include these knowledge systems and indigenous practices that are embedded in our systems that we tend to overlook sometimes in our discussions. And just quickly on the food security, and I'll hand over to Funmi also. We will also focus specifically on the socioeconomic factors concerning brain health in the third in our series. And a large part will be food security, because I think it's a challenge we face in many different parts of the world. And I know in South Africa currently there's a particular crisis, and it is something we need to start addressing as our approaches to better health. Funmi.
Thank you, Kirti. So when Harris was speaking, I remembered the presentation that one of the professors at the just completed AIC gave on food. We have the Mediterranean diet when it comes to, it's encouraged for dementia patients and stuff, but you notice that diet is really expensive. The average African cannot afford that. So we're encouraged to, of course, as everyone has said, look locally at what we can get. And little has been done on that research because there are 12 modifiable risk factors for dementia, but nutrition is not one of them right now. But I think it's very important, and lots of research has been done in that arena. And I think one of the things he mentioned was comparing the Mediterranean diet to the Yoruba diet. That's the Yoruba is an ethnic group in Nigeria. And I think going forward, that's something that maybe we in Africa can do. We should look at our diet and probably do more research on that. Yeah, thank you.
If I can just chip in one little thing, actually, it's not virgin land as such. I have a colleague who is a diabetologist in Cameroon. They have looked at our foodstuff and determined the nutritional components and all of that. And they have even written a book which is being used in secondary schools for that. And then nutrition is actually part of if you look at worldwide fingers studies, and now Africa is getting into that, nutrition, physical activity are some of these activities that are going to be studied in not long from now in Africa with other nations, and in a way that is comparable with other nations. So we are really coming up, and I think that this discussion is really very, very timely. Thank you.
Thanks. Were there any other questions? I can't actually see the...
Sorry, I was interrupting you to ask Johan to ask their question, but they left, sorry.
Okay. And was anyone else in the chat box, or does anybody else want to ask a question? You can just unmute yourself and ask if you're happy to.
A few questions on the chat. There's a question from Stefania.
Laura? Oh, Stefania, Laura.
Stefania,
Oof,
go ahead.
I can't choose who goes first.
I know.
Okay,
I would pick
unmuted.
Stefania. Pick Stefania.
Go, Laura.
Oh, she's gonna get mad. It's great to see so many people here. I was just wondering, are there any specific ventures that have to do with young adults and brain health in Africa? So anything to do with 18-year-olds or 18 to 39-year-olds, so that demographic. So in between, we talked about children, we talked about adults, but anything who are adolescents or emerging adults.
Something that comes to my mind, thank you, straight away when you mentioned that age group is drug use, abuse, addiction, and all of that. And I know that nations have different programs that are succeeding more or less. And it's very, very challenging. And the phenomenon is growing, and it's leading to violence in schools and in society. So that's a major, major, major area that nations and societies are struggling with, drugs.
Another one that I'm aware of that Laura and I have talked about, but it's good, I think, to open to this forum. The Davos Alzheimer's Collaborative is very interested in looking at dementia prevention starting in youth in Africa. The idea, and this is all led by Rhoda Au from Boston University, who's an executive with the Davos Alzheimer's Collaborative. Rhoda's thesis is that most of the cohort studies in dementia prevention start in midlife. Apparently it's like very hard to convince like Western funding agencies to start looking in young adulthood. And this is what Laura is an expert in. But Africa is open-minded. And so the Davos Alzheimer's Collaborative is looking to develop a cohort of dementia prevention starting from young adulthood. So this could be something that we all get behind as well, which would be a very important piece of work. And then, of course, Laura has her project, which is exactly aligned to this too, which we need to help her out.
On another point, Kirti, if I could just say, this is Shaka Fatah from the United States. So, you know, we have to think about brain health and connect it to brain science, right? We can't, these two things are interconnected. In the research in neuroscience all around the world. In America, you know, we have a major multi-billion-dollar initiative. You know, in China, there's a big initiative. Israel, Canada, the European Union, which really led the way in some respects. And I think Harris's point earlier about how we get a focus on Africa, right? I think that the point is that we have to make a case that all of the unanswered questions in neuroscience, notwithstanding all of the billions that have been invested, that some of those answers exist on the continent. That, and by not investing in African neuroscience, in the scientists themselves, in the laboratory development, and the different types of research that need to happen, that this is not something that's just leaving the continent out. It's actually harming the ability of the entire neuroscience community to come to answers for questions that have been chased for a very long time. So, you know, Professor Njamnshi has said, you know, if the brain doesn't work, nothing else matters, right? It was a quote that I always am reminded of by him. And Harris, I follow you on LinkedIn and all of the stuff that you've been doing. It's very important. But I think that the case that has to be made on behalf of the continent is that is inextricably intertwined with answering the major mysteries that exist involving the human brain, whether the healthy brain or how we treat diseases and disorders. That the human brain, the modern brain, emerged in Africa. And that, you know, looking everywhere else for answers other than the continent doesn't make a lot of sense, nor have we seen a lot of results in terms of the big, gigantic questions about brain science and brain health. So I think we got to make a case that this is important for science, and that the science is the way to the answers around health and cognition and all of the other issues. So I really just want to thank you for putting this this group together. It's been enlightening, and I hope it's the beginning of more dialogue. But I think the dialogue we have to make it, we have to make the case that is indispensable to the success of the efforts that scientists have been putting in all over the world. That finally, after we tried everything else, maybe we should come home to the continent and help develop African neuroscience so it can play the role that is needed to answer some of the unanswered questions.
Thank you, Shaka. I think there is a lot of insight that you shared, and yes, there's so much that that we can actually offer. And I think that's part of the reason for this conversation. It's really to actually look at brain health perspectives from different parts of the world. Coming back to what Laura said as well, and it also references what you were saying, Shaka, in terms of younger people. We do have a much younger population. So there is a much more research being done. It may not be under brain health umbrella, but like Alfred was saying, it is looking at issues that would affect brain health in younger people. So this would include mental health issues. It would include infectious diseases like HIV or other illnesses, again, as Alfred was mentioning, drug abuse. So a lot of research does actually happen, and a lot of programs, initiatives do look at that age group. So it would be interesting for you, Laura. Stefania, and anybody else who wants to contribute to discussion, even if it's not a question. So yeah, thanks, Shaka, for your insights.
Yeah, I had to wait patiently, so now I'm gonna shoot a million questions at you at once. This was fascinating. Thank you very much. I've learned a lot and kept nodding, although my camera was off. I particularly appreciated all the comments that were made about the necessity to contextualize research, but also interventions to the specificities of the population. And I stand fully behind that. Just maybe wanted to caution that it's really important to keep in mind also other aspects of diversity. Gender is the one I generally talk about, but there are many others linked to socioeconomic status, linked to education, linked to opportunities, and many other cultural underpinnings. But the question I had in the chat is, what is the role for researchers, policymakers, advocates like myself who are not African, who don't understand the context very well, but nonetheless would want to be allies? What is the way for us to feel helpful in a meaningful and non-intrusive way, not hijacking the agenda, but actually, you know, supporting effectively, I don't know, from a distance, through knowledge exchange, through conversations like this, through sharing the do's and don'ts of our experiences, or maybe other ways. Any thoughts you have on that, I'd be happy to take them on board. Thank you.
Thanks, Stefania. Funmi or Alfred?
I think you have already mentioned a few ways. One of the ways I would just add is in collaborative research. I usually learn on research because that leads to action, leads to policy. Collaborative research can be done from even with people who are living on Mars or on the moon, if they can connect to us. So I think that this is very good. Collaborative research would be a way. I mean, we usually back in Africa, one of the limitations to research, good research, is funding. And when we do collaborative research, we can find more funding and to do work that can be translated into practice and policy.
Funmi, do you want to add anything? I think I'll just add one of the things that I do think is to understand local context, but also one of the challenges I find is that sometimes there's the impression that we don't have resources. We have lots of resources, and lots of people come in. We don't have certain resources. This is true. We do have, you know, there's specific challenges that we need to address, and there are specific needs that need to be fulfilled. But often it's only looked at as that. And what we actually have in terms of resources, whether these are our cultural resources, our mineral resources, our human capital resources, are overlooked. And I think sometimes if we actually started building on the resources that we have, we may actually get to a better point than starting always at this impression that we don't have anything. And so I find that one of the biggest challenges with these collaborations, actually. Ethel.
Ethel, can I cut you short for a few seconds before you go on? I know you'll understand reference. So there are two questions that were asked earlier in the chat that I want to highlight first. So there's a question from Paul Derrickson. Do you have examples of broad-based implementation of a brain health, brain capital strategy in a large community or a nation? If so, what are the critical success factors? So I think that goes to Harris. And there's another question from Nyanzi Timothy of how does technology impact brain health, both positively and negatively, and what measures can individuals take to maintain a healthy balance in the digital age? So Funmi, Alfred, and you can start thinking about this. The second question is Harris answers the other question.
Thank you very much, Kirti, and hello, everybody. Yes, indeed, a wonderful conversation we had. And yes, I've learned quite a lot. I've recently been, you know, introduced to brain health, although I've got quite a bit of experience within mental health. But I also just wanted to contribute to Laura's question. In South Africa, we actually have very good data collected amongst youth. We've got the Youth Risk Behavior Survey, which is a national survey that's conducted amongst youth. And it started back in 2000, I think. And this is the 5th round of the survey. And it really collected very, very good data in terms of health, mental health, HIV, risk. And so, yes, we definitely have some good data in Africa, and I'm not sure if there's other countries that also collect similar data. So yes, just wanted to contribute. Thanks.
Thank you, Ethel. And Harris, do you want to go first? And I will take the second question, and then we will unfortunately have to end.
So on the topic of a sort of countrywide brain health or brain capital strategy, I don't think it's ever been done successfully. It's been tried once that I'm aware of in England back in 2008, I think it was. It was called the Mental Capital Project, and it was held through some Office of Science or something in the UK, so you can Google it and find it. But now, and it sort of don't think it really achieved much other than some nice reports, but that isn't what we're here about. We want impact. So we need to try again. And I think the strategy is to really to get the right buy-in from the right politician at a country level, and to then establish a task force of people that are from diverse parts of society, and some private sector people, some public sector people, and people from built environment, education, etc. And then they have enough funding to develop really an approach for the country. What sort of 5 to 10 projects would they want to have funded? This is the kind of strategy I think that makes sense, and we're exploring it in California and Pennsylvania at the moment, but we should explore anywhere around the world where we think that we have a politician that's seriously committed, and we can have this type of task force that wants to get in and do some serious work.
Thank you. The second question, Funmi or Alfred, do you want to answer that? And I think there was one more question, Wembui, from Smangali, so I'm going to have to make an exception. No?
Yeah. So the question, Funmi, I think you can go ahead on the question on technology.
What was the question again?
I'll go back to it, but it was about the opportunities for brain health in the digital age, and also the negative aspects of technology and brain health.
Also, the impact of technology. I've been working with one of my fellows using VR to improve brain health. I can only talk about few of the positive impacts, and I was involved in measuring the outcome of that, and we got really good feedback in terms of the experience they had using VR to improve their brain health or well-being. They had several experiences using that. That's technology. That's the positive aspect. But also it can be negative because you have, I think, was it Harris mentioned fake news in his presentation. So that in itself has a lot of negative impact. And also, such news or, the advent of social media can result in a lot of pressure on our mental health and well-being. So that's as much as I think, yeah.
Technology and health in general, and technology and brain health in particular, is very important. If we understand what we understand today about the brain, how it functions normally and how it functions in disease, it is thanks to imaging, it is thanks to different modalities of imaging, it's thanks to technological developments in genetics and other biochemistry and immunology and all that stuff. If drugs have been developed, it is because of technology. So that is a big, we don't make any discoveries without discoveries in technology. So that's great. But again, some of the technologies in terms of social media technologies that have come up might be addicting, and that affects our brains negatively. So we have to be careful. Even our phones and computers, we need to know how to use them carefully. Thank you.
Thanks. Maybe the last question from.
Yeah, I think I'll just highlight, I promise you this is the last question. I know we're having Zoom fatigue. So the question is from Smangali, and I hope I'm saying your name correctly. And it's about what role will specialist panelists said theories such as Black consciousness playing the list, the South African country, the social sciences are the most underdeveloped field in Africa. But for example, my friends would be less inclined to accept that brain health is a major concern for South Africans. And most of them are in the political space and are opposed to the leaders of the future. This is true for those who are placed to be leaders of industry. The question then turns on to the incentive that brain health offers young people who are quite frankly angry and disillusioned with the African identity. I'm asking as a philosopher who understands how difficult it has been to pursue research that promotes the African identity in South Africa, since the government doesn't seem to understand the value proposition of research in the social sciences. So anyone who can take that up, and what's the place of social sciences in neuroscience research, and how do you connect that? And especially thinking of race in places like South Africa and also the continent.
Alfred?
Do you want me to go for that?
Yes, yes.
Social sciences have a big place in health in general and in brain health in particular. There is what is known as social determinants of health. For the sake of time, we cannot go into that. But social sciences are very, very important. And in most research groups now, there is always a sociologist, anthropologist that brings their contribution to knowing why people behave the way they behave, social groups behave the way they behave. So it has a big place. The question was very long, but I think that's a short answer I can give. Thanks.
Harris, you look like you wanted to add something before I close the meeting.
And I put it in the chat.
Okay.
But I think, social sciences within that is, well, it's a question, definitional question. I think the arts is critical. So how do we leverage celebrities to get people interested, to open people's minds? How do we leverage storytelling? And storytelling needs to be relevant to the community. How do we leverage performance? All of this comes together in this social movement approach. And if the politician's going to pay attention, it's because there's a social movement behind it. I think of like soccer players in Africa. Like, how can we get soccer players to be inspired about this stuff, and to give community relevant messages?
Thank you.
I've tried but not succeeded. I've tried but not succeeded. Harris, we need to work. There's a lot of work together.
Great.
There was an excellent question, Magalisa. Thank you for it. And I think it also becomes, how does social sciences and Black consciousness movement change the way we conceptualize brain health, right? So it's both ways. So we invite you to our further meetings and to ask those questions, so to get us thinking, actually. Thank you, everyone. Thank you to the panelists for joining. It was such an exciting discussion, and really, I think, got us all thinking in different ways. Provocative questions, provocative comments. Thank you, everybody, for joining and contributing. As I started, I said, it's really quite important, and I'm very passionate about it. It's work that I do with Wimbuyi and others at the Africa Brain Health Network. It really is about building this community to create connection and identify the people working on the continent, so that we can actually put all these different pieces together. So I invite you to contact me or Wimbuyi to be part of that. And our next meeting is going to be on the 5th of September. It will look at life course approaches to brain health. So Laura, I hope to see you there. And I was almost going to say Lorna, but I didn't. Excellent. So thank you, everybody, for joining. And I will hopefully see everybody in September. Thank you.
Thank you, everyone. Have a good evening, morning.
Thank you.
Thank you for
Have a good evening.
Bye.
Thanks, you guys. That was great.
Yeah.
Later. Bye.
Thanks,
Thank you,
Kirti.
guys.
Wonderful.
Thanks, Andre. Sorry, I forgot to thank you, Andre. Thank you.
No, don't. I thank you all.